Hi, I'm Doug Pittman and welcome to Signature Minutes. The title of today's presentation is Lipidology 101. But before I get to the structured part of this presentation, let's meet the enemy head on. First, the chocolate chip cookie. Think of it as chipping away at your life expectancy. Next, the donut. Should be renamed the do not. Miss the garbage. And the greatest culinary death trap ever perpetrated on man, the fritter. I mean, look at this thing. It looks like a hunk of plaque to begin with. What do you think it's going to look like when it deposits in your arteries? Not much better than this. Lard covered dough glazed with sugar. When this thing gets into your bloodstream, the amount of triglyceride goes through the roof, and we'll get to that in just a minute. In recent years, the need for the consumption of fats in the diet has become well defined by the medical establishment and more clearly understood by the general public. Despite this, coronary artery disease is still the #1 killer of men and the #1 killer of women over 40. As we know, there are good fats and there are bad fats. Fats that come from four-legged animals laden with cholesterol are bad fats. Fats that come from fish are good fats because they provide omega-3 and omega-6 oils that can reduce the risk for cholesterol plaque formation in the blood vessels. Fat from vegetables, with the exception of coconut and palm oils, such as canola and olive oil, also provide protection from plaque formation and atheroma production. Far more dangerous to the body is the consumption of simple sugars along with fats, with the reflex release of large amounts of insulin, which promotes weight gain through fat storage and inflammation of the blood vessels via the inflammatory properties of insulin. Insulin is a very inflammatory hormone. In addition, the consumption of simple sugars with animal fats greatly increases post-digestion levels of triglyceride, the substance made by the combination of sugar and fatty acids in the bloodstream. Triglyceride acts as an abrasive on the delicate inner lining of blood vessels. This damage eventually leads to potholes or tears in the arterial structure of the coronary arteries, which subsequently become filled in with cholesterol, plaque, and calcium. This narrows the arteries and makes them more susceptible to thrombosis or heart attack. The VAP blood test, the Vertical Auto Profile, provided by Atherotech Laboratories in Birmingham, Alabama, provides a fine-tuning evaluation for both cholesterol and triglyceride. By fractionating these lab tests, by fractionating cholesterol and triglyceride into their lowest common denominators, a much clearer picture of cardiac and stroke risk in an individual may be ascertained. Once the risk is defined, appropriate therapy, including diet and exercise, supplementation with vitamin D, omega-3 oils, omega-6 oils, and medications can be structured. As a result, the VAP test was named one of the 10 ways to live longer by Forbes magazine and was selected as one of the 5 tests worth paying for by the Wall Street Journal. Ask your doctor about a VAP test. Thanks for watching.